Welcome back. More than 9 months into the pandemic, congressional leaders have finally reached an agreement on a second COVID-19 economic relief package. Legislation includes $600 checks for many Americans, $300 a week in extra unemployment aid, renewed aid for small businesses, and funding for vaccine distribution. Is $600 enough? We asked people from the Bronx and beyond to share how they feel about the upcoming stimulus checks.
In my honest opinion, I don't think $600 is enough for anything. You can't pay your rent, let alone get food. You know, the Christmas holiday is here. They want us to spend money on getting things for our loved ones. But, you know, it's hard with us only expected to get a certain amount of money. And then they don't necessarily differentiate who is and who isn't going to get the money, because I'm sure people who are employed are going to be getting this money as well. And, you know, it doesn't necessarily, the pandemic necessarily didn't affect people who didn't stop working. I don't want to say they don't need it, but, you know, there's a lot more people that are less fortunate and have lost jobs and have a lot of things going on in their life where they value every penny, every dollar. And, you know, they didn't really create a system of value and, you know, who's going to get this over the next. So I really think it's tough to, you know, actually figure out something, but $600 is not enough.
I feel incredibly frustrated, unprioritized, disappointed, let down, and most of all, disrespected in the highest form possible financially with the government and their relief package. I don't understand what $600 would really be relieving people of. What I'm going to be doing with my $600 is just paying my credit card bills, and that's where it goes. And if it doesn't go there, it's going to go towards my light bills for the next 2 months, or even the next month. Who knows? I work from home. I have a whole family of 5 here, and taking on so many responsibilities now that I just have to be adapted to because of COVID. $600 doesn't do anything, especially in a whole year. It's a huge slap in the face, knowing that the government has so much money.
I think that the COVID-19 bill is honestly an insult to the people of this country, and it shows that our representatives do not have any sort of connection with what their constituents are living in and day out. $600 is obviously not enough for anybody living in this country. It doesn't even cover the median rent in the cheapest states in this country. And if you were to look at any country on the same level as well as the United States, they have done far more for their citizens and constituents than we have.
So I think the $600 COVID relief bill that was passed, the stimulus package, I'm happy that it has been passed. However, keep in mind that when we hear from the House Speaker Nancy Pelosi that this is a first step, this will be split into 2 bills. It's one of those things where we say, great, we're happy to have it. A lot of people are happy to have it. However, this took entirely too long. And when we factor in the amount in terms of the salary for our senators and our Congress people, it comes to that point where you're saying, wow, I really wish we could afford lobbyists. We really do need lobbyists for our own interests, effectively to survive. That's our main interest. Because $600 to combat the amount of back rent and as well as purchasing of food, just surviving is, yeah, it's egregious. It's terrible. It's not enough.
I personally believe a $600 a direct payment is not enough to support and feed a family. I believe also Congress has failed their people and their country. A lot of people suffering. A lot of people losing their job. A lot of people going hungry. This is not the right support.
I'm not too excited about the stimulus package, the new announced plan for the package. I don't think that's going to be much help to any families out there. I don't think that's enough money to really take care of anything. I don't think that eases anybody's mind that's unemployed. It's kind of really tough to deal with, you know, but after the first one and then not getting one for so many months, I don't think anybody's thinking this is going to completely change the situation, but hopefully maybe there's somebody out there that it does help. You know, $600. It'll cover groceries for the next month, couple weeks maybe. but I don't think it's something that's really helpful or fair. It's hard to look at, especially, you know, when you have the internet, you see all these other countries that were way better taken care of than we were. So, you know, it's unfortunate, but from the Bronx, we get through it. We're going to find a way, make use of what we got.
$600 from your 116th Congress. That's 535 voting members. $600. That's about 2 weeks on minimum wage. And that's if you're working full time. What do I think? I think it's the biggest betrayal since Southern secession. The fact that we have millions and millions of Americans here that can't afford to pay rent. Small businesses that don't know how they're going to survive. Many here in New York are disappearing. A lot of places that, you know, we've come to love have disappeared. And $600, it's not enough. It's not enough. It's a betrayal to the American people.
Truthfully, I feel like it should have focused on reopening our economy and getting Americans, specifically employees from small, independently owned businesses, back to work, because they've been feeling it the most throughout this whole entire pandemic, which is very unfortunate. Also, the $600 stimulus check, it's just ridiculous. What could you do with that money? Obviously nothing. So it's very unfortunate.
Have you gotten tested for coronavirus? Or have you heard that it's painful? And COVID-19 vaccines have arrived in New York City. Our BronxNet reporters have these stories, updates, and more just for you.
Living in New York City during COVID-19 means that you'll probably see lines wrapped around the block at many of the city MDs. But places like SN Healthcare here in the Bronx are empty.
City MD lines have been wrapped around the block for months as New Yorkers rush to get a COVID PCR test or COVID antibody test for the holidays. Yet, some New Yorkers remain hesitant to get tested. After I shared a post on social media asking people to explain some of their misconceptions preventing them from getting a COVID test, the number one response I received was that they heard it was painful and they don't want any parts.
It's usually a tolerable exam. It does feel like you're almost like getting stimulated to sneeze, or like I like to tell my patients, like you're almost gonna get your brain tickled a little bit.
Dr. Goris from SN Healthcare says that getting a COVID test is similar to sneezing, and if administered correctly, there shouldn't be any pain. He notes that if a patient is fearful of getting the antigen test, there's also a COVID saliva PCR test, which is one less evasive option that many have opted in for. In an effort to address if a COVID-19 test is painful or not, I figured there's no better way than to get tested, but on camera. SN Healthcare's Dr. Alexia administered my COVID-19 antigen test and walked me through each step.
This is what's going to go in the nose, and I'm going to have to use both nostrils. And the sample will be going in here, and we'll send this to the lab. I've heard, this tickles. I've heard this, this can trigger you to have some water in your eyes. It can trigger a sneeze. But I haven't heard anyone to say, this was painful. I haven't heard that yet.
The entire testing process took less than 7 seconds. No pain, and at the height of the discomfort, it felt like I had to sneeze.
Dr. Goris and Dr. Alexandre said that you should get tested as often as you can to prevent the spread of COVID-19.
It's good to get tested because if you're healthy and you don't have much symptoms, you can end up giving it to somebody else. You can just end up just spreading it to so many other people with comorbidities.
As of this week, 4,000 New Yorkers have been vaccinated with Pfizer's vaccination, and another shipment of 346,000 vaccines from Moderna is expected to arrive in New York by December 22. As essential healthcare workers, both doctors will take the vaccine, but stress the importance for the general public to continue to get tested for COVID-19 during this time. Reporting for BronxNet, Darissa White.
It's been 48 hours since the vaccine arrived in the city, and over 1,600 healthcare workers have been vaccinated. Wednesday morning, Mayor de Blasio visited Elmhurst Hospital and witnessed William Kelly and Veronica Delgado be the first healthcare workers at the hospital to get their COVID-19 vaccinations. The two were also the very first to receive vaccinations in New York City's public hospital system. The mayor thanked all healthcare workers at Elmhurst, which was once the epicenter of the pandemic.
We're celebrating such an important moment here. The first ever vaccination at a New York City public hospital. And there's no more fitting place than here. This is the place where it should be, because this is the heroic place. I will tell you for the rest of my life, when I hear the words Elmhurst Hospital, I'm going to think of heroes, and I'm going to think of a battle that was fought and won.
The city's public hospitals have consistently struggled with federal funding. According to a 2016 article by the New York Times, it notes that the hospitals were once on the brink of a financial crisis. With the $2 billion subsidies in 2016, Elmhurst and many other public hospitals were able to contribute to the vulnerable populations when the virus spiked.
For a long time, HHC, then Health and Hospitals, were ignored in this city. They were too often put down, too often starved of funding. Several years ago, before we ever heard the word coronavirus, we made a decision to invest in H&H, billions of dollars, to make sure our public health care system was strong. We made a decision that the future of New York City depended on H&H.
Mayor de Blasio also warned that the city may be impending another shutdown of non-essential businesses, similar to the one issued in March as the daily COVID indicators increase. The decision is left to Governor Cuomo, who has also hinted such a measure might be necessary. Reporting for BronxNet, Ashley Tiffany.
It's that time of year again. New Yorkers are now entering the midst of flu season as we approach winter. Specialist on infectious diseases for Essen Healthcare, Dr. Mana Rao, explains why the flu spreads easily during colder months.
There used to be this misconception that the winter causes the flu, but that's unfortunately not true. People spend a lot more time indoors with the doors and windows closed, and there's a lot of recirculated air which they breathe. And so if someone's harboring the virus or if someone's sick, there is a greater potential for transmission.
A similar pattern is shown with COVID-19. As the CDC reports, it's likely that flu viruses and the viruses that cause COVID-19 will both spread this fall and winter. While the city waits for the COVID-19 vaccine set to release this month, health providers and city officials are urging New Yorkers to sign up for the flu vaccine. Dr. Rao explains why the flu vaccine is critical, especially this time of year.
For the reason we want people, and we push rather for them to get the influenza vaccination is because, as I said previously, the two can occur together. And we don't know if the co-infection of SARS-CoV-2 and influenza can be potentially more severe than either of them alone.
At the start of the pandemic, there were many misconceptions about COVID-19 and the flu. During this year's flu season, it may be hard to tell the difference between the two viruses, as both are contagious respiratory illnesses with clinical features that can overlap. Dr. Rao points out these key features to note when differentiating the two viruses.
Influenza, while it can be severe, can also cause mild to moderate disease in a number of individuals. COVID can tend to be more severe, as we know, in those who are above, 65 years of age, those with certain medical conditions, and those individuals who have a compromised immune system.
Both viruses also share many of the same symptoms. Some include fever, chills, cough, and shortness of breath. However, there is a major differentiating symptom to look out for.
SARS-CoV-2 virus, which causes COVID, can lead to a loss of taste as well as smell sensation, which we haven't seen with influenza thus far.
At the moment, Dr. Rao believes there isn't enough evidence to fully determine how flu season will react in the wake of COVID. In the meantime, many health professionals encourage everyone to practice these preventative measures to keep their family safe this season.
Wearing a mask, which is universal source control, frequent hand washing, either with soap and water or alcohol-based hand rubs, social distancing, and avoiding large gatherings, getting your flu shot.
To learn more about the flu and COVID-19, visit the CDC link below. Reporting for BronxNet, Kibana.